All right, hello everybody. So my name is Lauren Rifkin, and this is Mark Cornell. We created this physical therapy program for patients that are on dialysis. We did this through UCLA's CORE Kidney Program. We decided to call this program Mind Body Wellness on Dialysis. And just to give you a little bit of background about myself, I am a core volunteer at UCLA. I also have my bachelor's in clinical exercise science, and I've been working at a physical therapy clinic for almost a couple years now. And I've been working with Mark to create this physical therapy program that is targeting the mental health of the patient as well as the physical health.
Thank you, Lauren. My name is Mark Cornell. I'm a certified personal trainer, been training since I was 16 years old. Very brief on my story. I was diagnosed with kidney disease at 26, ended up going on dialysis, and now I'm post-kidney transplant. I'm the lead patient advocate for the UCLA Health Core Kidney Program, here to just give you guys information and education for patients who are on dialysis and as well as post-kidney transplant.
100%. We're really excited to be sharing this program with you guys, and with Mark and I's combined knowledge, we have put together this great program. So we're excited to run through that with you. So first and foremost, we have a couple goals from the program. The first is to just inform and educate you guys on how exercise is going to be beneficial in aiding you throughout your treatment on dialysis. And on top of the fact we're going to provide the program for you guys, which is going to target a variety of different patients based on their different physical activity levels, because we understand that every patient is different. Every patient is comfortable with different things, or they may be a little more used to physical activity. They may, just kind of be starting off. So this program is for everybody, and that's what's really great about it, is how accessible this will be to a variety of different patients. And here's just a little disclaimer. So we do want to just let you guys know that this is just for information and educational purposes. Please talk to your physician, your nephrologist, your doctors before you start this program, and make sure that you are cleared to do so.
So, one of the key things about the importance of exercise while on dialysis and wanting to know the benefits of that is we want to increase the physical strength, the energy level, and the overall physical fitness. Key things about being on dialysis is that we're on dialysis 3 hours a day. Now, what we wanted to do is really implement the reduceness of being fatigued, right? But not also that, but also reduce the anxiety and depression that us patients go through while actually being on dialysis. Some of the key factors that we also got to consider is the reduce of developing other chronic health conditions such as heart disease, strokes, and type 2 diabetes. Being on that chair when we're getting blood and our blood being cleansed. We deal with a lot that's going on, electrolyte imbalance, sitting on that chair, headaches, depleting of all the liquid that's in our body. But also our goal is to maintain that muscle mass. I remember as a patient, I lost so much weight. I walked in at 172 and I walked out at 134 at the time that I ended up going on to that kidney transplant. But also lower hormone levels, control blood pressure, prevent fragility for patients preparing for kidney transplant, right? One of the key things when I was getting ready for a kidney transplant, I was just so fragile. And one of the things that I want to really emphasize, that if it wasn't for either stretching, working out, doing these breathing techniques, I wouldn't have gone through that kidney transplant the way I did, and getting approved through going through the kidney transplant. But overall, we want to improve the cardiovascular health and the bone density. Now, my recommendations, and this is both on our sites on what we've done through the educational component, is the recommendation of doing this is about 2 to 3 times a week. So for those of you patients who are wanting to say, well, can I just start working out? Yeah, talk to your healthcare physician, talk to your team, and see if 2 to 3 times a week is good for you. You can also just start off with one, but the goal is to do 2 to 3 times a week.
Well said, Mark. Thank you for that. So just basically just a little bit about this program. So this is going to be a full body routine. We're providing a variety of different exercises and stretches. This program is beginner friendly, so this is for everybody. It is a very generalized program, so it does target patients who are just kind of starting off with exercise. They may not be too familiar, But we're also giving options for patients to, for patients that are a little more familiar with exercise, there's an option for them to progress the exercise and make it a little more challenging. So that is going to be a huge part of this program is how accessible it is for everybody. There's no gym membership required. So you could do all these exercises in the entire program from home. And that's what's something that we really love about this program. You can use household items. So this is going off of what I just was talking about. You can use canned food for weights, plastic water bottles as dumbbells, beach towel for stretching. So really, you don't need to purchase any equipment. Of course, you could if you wanted to. If you wanted to use actual workout equipment, totally fine. But you can do all of these exercises and stretches with items that you find in your home. So starting off with stretches, this is really important because this is going to warm up the muscles. This is going to allow us for better movement, more optimal range of motion. This will also prevent injury and increase the blood flow in muscles. So it's a super important part of the program. It's super important to start off with stretching and just getting the muscles in the body ready to go. And so here are our stretches. Okay, so this is the first half of our stretches. We have the seated hamstring stretch. And as you can see, Mark is over here demonstrating the seated hamstring stretch. You can do this on the floor. So for patients that are more comfortable getting on the floor, you can do this on a mat, or you could do this sitting in a chair if you're not comfortable getting off and on the ground. And as you can see, he's using a belt there just to assist with the stretch, pulling his toe towards him. That's going to allow him to feel the hamstring stretch. Okay, and those hamstrings, those are the muscles that are in the back of the thigh. So that is where you would be feeling the stretch. We also have the pigeon and the seated piriformis stretch. So you have the two options there to do this in the chair, or you could do this on the mat. The piriformis muscle is a small muscle located in your bum, kind of towards the bottom outer part of the bum there. So that's where you should be feeling that stretch. And then we have the kneeling rectus psoas stretch and the seated quad stretch. So really we're targeting the muscles in the quad or the front of the thigh, and as well as the hip. And you can see there's two different ways to go about this stretch. You could do so on the mat, leaning forward. Okay, and this is the proper form for all of these stretches. So you can use Mark as a reference for that. All right, and then just to continue here, let me move this out of the way for a second. All right, so our stretch is continued. So we have the overhead shoulder stretch. So we're targeting the muscles in the shoulder here. We have the prayer stretch up here. So we're really getting the muscles in the wrist, as well as the muscles in the legs here and the adductors here and the calf muscles. This is a really good stretch down here because I know a lot of patients on dialysis get cramping in, I know cramping in their calves is pretty common. So this is especially a really good stretch for a lot of people. And as you can see, he's just using a belt there to help assist with the stretch. And then we're also targeting the lumbar spine with the cat-cow. And many of you might be familiar with the cat-cow, but you could do this seated, you could do this on the mat. So there are options here for you. And again, all these stretches, we're targeting full bodies. We're getting the wrist, the shoulders, the back, the legs, all that good stuff.
Now, based on the cardio suggestions, right? As patients, we're always on dialysis, and we have our consistent schedule where it's Monday, Wednesday, Friday. Now, according to AH recommendation, at least 150 minutes per week of moderate intense aerobic activity, or 75 minutes per week of vigorous aerobic exercises, or combined of both. And one of the greatest suggestions that they've given is walking every day for 25 minutes. Now, based on the last slide, as you know, patients, if there's too much liquid being pulled out from being on dialysis, those cramping tends to be a very, very huge factor. Now, me as a patient, I have gone through those specific cramps, and I know how some of you guys feel when it comes to getting those cramps. So a lot of the exercises and stretches that we did prior, please consider to doing those specific stretches for your calves, for your quads, and all the ones that we provided in the prior slide, because it'll play a very, very vital role for your dialysis treatment and making sure that your body is fully stretched. Now, here we go with the upper extremities, right? So when we considered doing this, I was looking around on a dialysis chair, And as you know, with people who are on dialysis, there's several types of ways you can get dialysis, whether it's a fistula, a PD, a specific catheter. So those were a lot of the considerations when we thought about doing this kind of thing, right? Now, we wanted to make sure that our muscle and the muscle groups targeted for the upper extremities are the deltoids, biceps, triceps, rhomboids, traps. And these are just some of the main muscle groups that we wanted to make sure that we focused on. Right now, being a dialysis patient, there's a lot of times that we're sitting most of the time. And when we go home, we tend to sit down because we are trying to recover from our dialysis treatment that day. So we came up with ways as far as sitting and standing by doing these types of bicep curls. Now, some things to consider, just like on prior slides from Lauren saying, I'm here sitting with a Gatorade bottle as well as a water bottle, and you can start from there. But also make sure to consider is to speak to your doctor that you're not going overweight where your fistula or your PD catheter or even your catheter that you might have on your chest might be in a jeopardizing situation or predicament. So make sure that you talk to your doctors about this particular exercise when it comes to fistulas and anything that has to do with ports or anything like that. But here are some of the basic fundamentals of starting an exercise routine. Now, upper extremity exercises also continue, right? Not only are we considering doing biceps, but also seated and standing tricep extensions. As you can see here, you would place your hand right behind your head, and then you're going to do an extension going up, right? And here I'm demonstrating it again with the Gatorade bottle. It doesn't have to be a huge amount of weight. All that we want to do is to make sure we get you to the generalization of exercising so that you get that body moving. Now, here's another exercise that we came to provide is seated in standing rows where you're bringing it in, bringing it out, bringing it in, bringing it out. Again, I want to emphasize these are Gatorade and water bottles, right? I wanted to make sure that we considered a lot of the people who are on dialysis who are actually really scared. Can I pick this up? Can I pick that up? Yes, this is a full demonstration. We've done our research, and thank you to the lot of doctors who've helped us create this program because this is for you. Now, here's also another exercise, seated and standing shoulder abductions, where you're bringing your hands up and down, right? Again, fistula consideration. But here are some of the workouts that you can do seated, being seated and or standing.
Perfect. Well said, Mark. Well said. And for some of these names have a pretty self-explanatory explanation of where you should be feeling the muscle, the tricep extensions and the bicep curls. So the bicep curls that we were just kind of looking at is going to be targeting the biceps right here. We have our tricep
Right.
extensions. We're going to be feeling the triceps back here. And then as for the rows, we're really targeting muscles in the mid back, specifically the rhomboids. And of course, the shoulder abduction, we're getting the delts and a variety of different muscles here in the shoulder. So that is where you should be feeling this exercise, should be feeling like a burning, like the muscles are working. All right, and then
Gr-
moving on to the lower extremity exercises. So here are the muscle groups that we are targeting right up here. And then here we have Mark demonstrating the seated and standing hip flexion. So here's another example of how you can do this exercise in a chair or standing up. So again, whatever the patient is comfortable with. You guys have a couple different options to do this. So here he is, he's sitting, he's just bringing his knee up one at a time, and you would just be alternating. You would be alternating here. And generally, we should have mentioned this a little earlier, but the right amount of repetitions and sets, the sweet spot, the good number is 3 sets of 10 repetitions is the most ideal for all of these exercises. So you guys should definitely keep that in mind. That is the most optimal amount of sets and repetitions for building muscle. More sets and less reps. And you can even start lower than that. You could do a couple sets of 10. You could do 2 sets of 10 if you want. But 3 sets of 10, I would say, is the goal. And so seated standing hip flexion. Okay, so we're really working the muscles in the hip, those hip flexors. We have the sit to stands down here. This is a very practical exercise, which will be very helpful for a lot of patients. This is basically you're going from the seated position to standing, and you would be repeating that. Seating, standing about 10 times, coming to a full standing position. This exercise specifically needs to be done in a chair or on a, where you could be seated. And we're working the muscles in the lower legs, so the glutes, the quads, hamstrings. So that's where you'll be feeling the burning there. And then continuing on, let's move this out of the way here. Lower extremities continued. So we have the seated and standing calf raises. So Mark is demonstrating the calf raises here standing, and the calf muscles. Those are the muscles right back here in the back of the leg, the back of the lower leg. And there's a couple different ways to do this. We have an example of the standing here, like I just said, and the seated. So I'm actually demonstrating this just sitting on the edge of my bed. So you could do this on the edge of your bed. You could do it sitting in a chair. You have options there. So there's two different ways to do the exercise based on your comfortability level. And then we have the bridges down here. So this is this exercise should be done on the mat. So ideally, if the patient's comfortable with getting on the mat, this would be a good exercise for you. There's two different ways to do this. So you can make this a little more challenging. You could do the classic bridge with bilateral legs. This is just lifting the hips up to a bridging position and then squeezing the glutes at the top. And that's going to help accentuate the exercise there. And you should be feeling this in the hamstrings and the glutes there. And then the single leg bridge, this is the more challenging form of this exercise. So you could do one leg at a time, just as Mark is demonstrating there. So you really just, as you're going through the exercises, you want to just gauge your own, your own physical activity level and what you feel comfortable with. And if one of these exercises is feeling easy, you can make more challenging with, doing one leg at a time, or you could even do more repetitions. You could do 3 sets of 15 if you're feeling good and you want a little more of a challenge.
Right. So thank you, Lauren, very much. And again, please consider to doing at your own pace, right? Because a lot of the things that we want to make sure we emphasize is if you feel good, we feel good making this program for you guys, right? Because our goal is just to get you one step and one step forward, right? And the only way we can do that is if you, and as patients, we know our bodies so well. If you feel like you're getting dizzy, if you feel like you feel way more fatigued than normal, consider to just bring that number down. It doesn't necessarily mean that we have to do the 3 sets of 10, the 3 sets of 12. Listen to your body. Right now, we're getting right into the core exercise where PD and again, hemodialysis catheters are considered. And one of the things for me when I was actually thinking about doing core exercises and really talking to physical therapists, my nephrologist, my PCP, like, can I do these workouts with a catheter? Seeing my buddy on my left who had a fistula, or someone on that PD cat, right? How is core exercise and how is it going to be beneficial? And based on our research, crunches are really good, dead bugs, planks with or without knees. And here are some considerations you want to look into, right? Are you really working your abdominal wall? Now, again, I really want to emphasize that we have to talk to our primary care, our nephrologist, and our team, because this can also mean a big factor, right? I mean, this is our lifesaver. Being on dialysis is making us have that longevity in life, which is what we're trying to do here. But the core exercises, right? Now, here's a demonstration of me doing some core exercise, specifically here with the crunch. I'm trying to stabilize my lower abdominal. Again, for some of you guys who are on PD, listen to your body. Does it hurt? Is it cramping? Is there some form of pain? And if so, just reevaluate. Go right back to your basic situation and scenario and retry that again. Dead bugs is another also good core exercise where we can stabilize it there. Hold that for about 10-15 seconds. I'm trying to push that out for a minute. I want to be that best dialysis patient who can hold that hold for so long, as well as the plank holds. Now, here's one thing we got to consider with planks, right? And that's why we have two variations here. One's a bit more advanced for some of you guys who are on dialysis, but also we have it where you're on your knees. And that would be another way if you can't stand on all fours, which I recommend you starting off with your knees on the floor. And once you build and develop that strength, you can get right onto being on all fours. Now here we're going right into the breathing, and we haven't talked about breathing, right? Because one of the key factors that go hand in hand, right, with a patient who has dialysis needs a dialysis treatment, which is the actual machine that actually dialyzes your blood. Now, it's the same thing when it comes to exercise and, exercises and breathing. Right now, what are the benefits of these breathing exercise? One of the key things that I started to realize while I was a patient on dialysis, that it actually lowered my blood pressure and it reduced a lot of my stress. Um, And with that being said, we do our blood pressure readings every 15 minutes on the dot. It's an automatic thing. Now, I started to realize when I was on dialysis, I would look at my dialysis machine and I would think, why is my blood pressure so high? And with that anxiety, that depression, and all those other feelings that are coming in, it's how can I reduce that? So I started to learn about pursed lip breathing, the breath of fire, and the laying down breathing, right? And I want to just get into helping you guys understand what that really means, and to actually help patients with that shortness of breath. Now, what is pursed lip breathing? Now, let's just say for the consideration that I am on the dialysis chair, what you want to do is you want to inhale for 2 seconds and exhale for four, right? And what you want to do is just inhale for 2 seconds and just exhale for four, right? And you do this consistently, you do this continuously, but you want to make sure that you don't get that dizziness, that oh my God, I'm taking too much oxygen to my head and I'm not able to complete doing this. But essentially what you want to do is just catch a rhythm where you're actually learning the in through your nose and out through your mouth. One of the great ones that I learned through the process of doing this, it's called the breath of fire, where you stand up upright and you're just breathing. And it really, really starts to generate a lot of that, that anxiety just starts pushing out. And that's what one thing we got to really, really focus on is eliminating that depression, eliminating that stress, eliminating that anxiety. And a lot of these things you can definitely look, and we can resource that for you at the end, when at the bottom of the link of our presentation, so that you guys can see different ways and different techniques of how to do that, right? So making sure that breathing techniques are a big factor to your exercise, making sure you're breathing when you're doing the bicep curls, the tricep extensions, the calf raises, those stretches. It is very, very important, very, very crucial that breathing is part of your exercise routine and techniques throughout your journey with mind and wellness on dialysis. So, one of the things that we were discussing when we created this program was the gratitude journal, right? And helpful tools to increase motivation to start your program. Now, what is that? Waking up in the morning and say, wow, what an amazing day that I'm still here and I'm alive. No matter how hard I'm fighting, I'm here for the fight. They say a healthy person has 1,000 wishes and a sick person has one. This is where that gratitude comes into place, right? Now, here's some recommended things that you want to consider when you write your gratitude journal. And this can be, you can go to the local shop, Target, any store that you can get a journal, and just start writing questions and then answer them. Like for me, mine was the thorn in the rose. What was my challenge and what was my accomplishments? And what do I feel grateful for today? Right? Like for me, I woke up today, I got to see my family, I got to see my fiance, I got to see my mother today, right? And we take a lot of losses, especially while we deal with health issues. Our blood pressure might be elevating. Oh man, there's another program. We might be going through the transplant evaluation and they're asking us to do more things such as uh, you need more test results and that's going to prolong it. But having a gratitude journal really reminds us what we're thankful for every day, why we wake up, and knowing your why on doing the things that you do. Make sure that you emphasize your goals, making sure that you try to hit them. Again, this is a step by step journey, right? You don't have to go through it as a sprint. This is a marathon. And that's why when we thought about doing these exercises, gratitude came into play. Because now that I'm here, I'm able to say, you know what? I'm thankful that I went through the journey to now give it to those who are on dialysis to say, you too can do this. So we came up with this gratitude journal. Please, this is also another key component, is really writing down what you're thankful for.
Perfect. And then here's a list of reviewers through UCLA that we had look at our program with us, give us some suggestions. And we want to thank you guys so much for watching and listening and being a part of this with us. We really hope that you guys give this program a shot, and we wish you the best of luck with your treatment and moving forward.
Great. Thank you, Lauren. And thank you, everybody who has sit down with this presentation. We are very thankful and very honored that a lot of you guys are considering to starting a journey to better health, to better education, to actually grow and understand while going through dialysis. If some of you are getting ready for a kidney transplant, but this is just really a generalization of getting introduced to the health and wellness world for those of you guys who are on dialysis. So thank you guys so much. My name is Mark Cornell, lead patient advocate for the UCLA Health CORE Kidney Program, and which really emphasizes clinical excellence, outreach, research, and education. And that's what we're here to do with Lauren, is to educate you guys about the growth of the wellness and health that you guys are going to be taking on this journey to better your health for the future.
Yeah, very well said, Mark. Well said indeed. Thank you guys again so much, and we hope that you have a great rest of your day.